Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. More states receive vaccines as Lagos State gets set to begin inoculation tomorrow. Ondo government tasks residents on the need for adherence to NCDC safety protocols as the Delta variant of COVID-19 fuels more cases in the state. And World Health Organization says coronavirus surges are pushing health systems of some Western Pacific countries dangerously close to a red line. And 5 people have died as a result of COVID-19 complications in Nigeria, raising the death toll to 2,281. According to the NCDC, Nigeria also recorded 655 cases of COVID-19 in 8 states and the FCT. Lagos, the epicenter of the pandemic, recorded the highest cases with 288, followed by Rivers, 188, and Oyo State with 64 cases. Here's more on the virus update.
The latest data from the Nigeria Center for Disease Control shows that the daily count of COVID-19 infections have risen to 655 amid the spread of the Delta variant in the country. The latest figures were reported from 8 states and the FCT, indicating an increase from the figures reported earlier. Lagos topped the chart with 288 cases, followed by Rivers with 188. 64 cases were recorded in Oyo. 31 cases were reported in Akwa Ibom, while 28 cases were reported in the FCT. 21 cases were registered in Ekiti. Edo had 17 cases, Bayelsa had 11 cases, while Kaduna registered 7 cases. There were 0 cases reported from Nasarawa, Ogun, Osun, Ondo, Plateau, and Sokoto states. The overall count of confirmed cases in Nigeria now stands at 188,243. 217 people have been discharged in the last 24 hours, increasing the total number of recoveries to 169,035. However, Lagos, Rivers, Akwa Ibom, and Oyo account for states with the highest number of cases currently on admission. The NCDC also reported 5 additional deaths from COVID-19 causes in the last 24 hours, raising the fatality toll to 2,281. Presently, there are almost 17,000 active cases in Nigeria, while over 2.7 million samples have been tested so far. In Africa, there are over 7.5 million confirmed cases and more than 190,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 213 million, while more than 4.4 million deaths have been reported.
The Nigerians are getting ready for the second batch of the Moderna vaccine and are being distributed to registered healthcare facilities nationwide. In Lagos, a tour around major facilities for the second phase of the COVID-19 vaccination shows that they are indeed receiving the Moderna vaccines. While the Moderna vaccines is a 2-day vaccination, the AstraZeneca is for those who already have received their first dose. With up to over 150 centers earmarked for the rollout in Lagos, authorities say actual dissemination will kick off tomorrow, the 26th of August.
This is the Moderna vaccine. It's a different type of vaccine, and it's also in a 2-dose regime. So it is specifically for people who have not yet benefited from the AstraZeneca vaccination. I am aware that our state government has made very elaborate arrangements to ensure that all the local government areas have vaccination centers, and these have been well publicized. It's in the news, it's in the newspapers, it's everywhere. So everybody knows where to go for vaccination. Also, instructions have been given about online registration so as to make life easier for people. Once you register online, you talk about where you live, and then the app gives you the nearest place to go and vaccinate, and automatically your name is already registered there. So by the time you are getting there, you have no delay in getting vaccinated. So talking specifically about Lassuth, what we're doing, happily, we are one of the designated vaccination centers for Ikeja GRA. So we are going to be offering the vaccine here in Lassuth for people in this local government area and who might have pre-registered online.
Staying in the southwestern Ekiti state, it has taken delivery of 46,000 doses of the Moderna vaccines, with public enlightenment heightened to ensure more people embrace it. The state authorities also speak to the issue of community transmission. Our correspondent Babajide Agbeyo has the details.
With the delivery of Moderna vaccines taken in Ekiti state, government has advised residents to maximize the opportunity and get vaccinated. The State Ministry of Health also says that an earlier report placing the state on red alert for the pandemic should be regarded an error. Nevertheless, the state admits that there is community transmission and that it is important for people not to get off guard at a time like this.
We're certainly not on any red list. Like I mentioned to you, there are 12 states as of today that have a higher positivity rate than Ekiti. So we're not in any way, form, or shape in a bad place, but we must be mindful of where we are so that we don't, get into a bad place. In the state, as I speak to you, we have over 30,000 RDT kits, and we'll be sharing those with all our private sector facilities.
Some residents speak on adherence to protocols and vaccination.
The awareness is a bit low. People are still scared that there could be aftermath effect of the vaccines. Whether it's a new variant or not, what we should know is that we should just keep safe.
In the meantime, the state government has announced plans to train private health facilities and equip them with kits for rapid testing to assist them in case management of COVID-19 across the state. Babajide Agbeyo for COVID-19 update.
Thank you, Babajide. And now joining us for more on the vaccines, Dr. Olusegun Ogboye is the Permanent Secretary, Ministry of Health, Lagos State. He joins us virtually. Thank you for joining us on the program.
Good evening.
Good evening. I'd like to begin by asking about vaccine awareness. What's your take, especially for Lagosians? Do you think that there is that awareness, Moderna has arrived, and that inoculation will begin as soon as tomorrow?
I think there is a lot of awareness, a lot more now than earlier. The vaccine hesitancy that we were seeing when the AstraZeneca first came, I think a lot of that has gone. I think the fact that now we're in the middle of a third wave has also made people really aware. We get a lot of calls. Even before the vaccines came, we were getting a lot of harassment from people about when it was coming. So I know there are a lot of people that are now aware that it's here. A lot of people are also aware about the registration site. A lot of people have registered for vaccination.
So another thing, the procedure for vaccination. Some who took the AstraZeneca did register, and this is with the National Primary Health Care on that website, the national website. But others didn't actually do that, and they just walked into a primary health care center, a vaccination center, and they were attended to. So what exactly is the procedure?
All right. The procedure really is to register online first. The first time, because we had some issues with the platform that made it really difficult and slowed things down, and so people got a little restless and came. And because there were serious crowds at the vaccination centers, and we didn't want them to become super spreader events, we then allowed people to come in and we would register them on site. But we've learned by doing, and the platform is a lot better this time, a lot more responsive. And so we are insisting now that nobody will be allowed in an isolation center who hasn't registered online prior to coming.
Okay, the vaccination center. So looking at the rollout plan, we know the first phase started with the vulnerable group, some, is it over 50? Now, has that expanded, I mean, to as much as 18-year-olds? Can they register for the vaccines now?
Yes, now we're doing everyone over 18 now. We're doing everyone over 18.
All right, and perhaps finally, will there still be enlightenment measures? I mean, there are some people who are still quite skeptical about taking the vaccines. Will that continue?
That is continuing. We have a team that is doing the social engagement to ensure that people are aware of it and aware of the need for it. The Ministry of Information is also, I mean, that's their specialty. They're also raising a lot of jingles and community engagements just to let people know why we must continue to wear our masks, wash our hands, and all the protective measures, and then also get vaccinated.
All right, we'll like to.
So yes, there's still a lot of public awareness that's going on, yes.
Okay.
Public enlightenment.
Enlightenment. We'd like to thank you, Secretary, Permanent Secretary, Ministry of Health, Dr. Olusegun Ogboye. Thank you so much for joining us on the program.
Thank you for having me. Thank you very much.
Well, let's go back to Ondo State, where the government is appealing to residents of the state to adhere strictly to the safety protocols against COVID-19. It warns that worldwide, the Delta variant is fast spreading, and with vaccines and the non-pharmaceutical interventions, life can continue as normal.
COVID-19 is a reality, and I want to just plead with the various accounting officers in various ministries. The ministries have a large number of people, and if every ministry will make the responsibility that nobody enters any of your offices without using, not just using the face mask, but using it properly. This morning we see pass through the secretariat. Several people in secretariat are not using their mask. Or even when they do, they put it on the shin. That's not using face mask. I think that we must also continue to let our people know that all this issue about sneezing, about coughing, and making sure that they come to their elbow or they cover their mouth is not a matter that is just COVID-19. It's simple hygiene. In fact, many of the things we are talking about COVID-19 are simple common hygiene. The only thing that is different is the face mask. Washing our hands is hygiene. Covering our mouth is hygiene. So we want to just use this opportunity again to plead with us very, very intently that please let us ensure that we are part of this battle.
Still ahead on the program, stakeholders in Yobe State raise alarm over a rise in gender-based violence cases during the pandemic. Please stay with us. Welcome back. Stakeholders in Yobe State have again expressed concern over the daily record of sexual and gender-based violence in the state during the COVID-19 pandemic, calling on government to take drastic action before it escalates. Records made available to journalists reveal that over 2,000 cases of sexual and gender-based violence were recorded across the 17 local government councils of the state.
Since the outbreak of the coronavirus in Yobe State, there has been an increased number of sexual and gender-based violence in the last year. The state police force reports that over 2,000 cases of gender-based violence were recorded in 22 months across its divisional headquarters.
Records show that as of even last year, we recorded over 100 cases of sexual gender-based violence alone. Other GBV, that is gender-based violence, we recorded more than 2,000. However, this year, there was not much increase, but the cases are coming in daily basis, I can say, or almost in daily basis. Cases of rape have been reported in various divisional police headquarters across the state.
At this consultative forum on gender-based violence, group gather here to discuss ways to mitigate the challenge.
we gather all the key stakeholders that are dealing with GBG and SHBG. We want to extract their strategy and ideas to find, to enable us to mitigate and prevent GBG in our society.
The state judiciary is also represented at this gathering. They highlight some factors that has led to the increase.
Most of our people are not, let me just say, they are shy to come forward to express their problem to the court. Especially, let me cite an example. When there's rape case, the mother will not allow the daughter to come forward and explain what is going on. And in a situation where we even have the courageous one that come, they will not be able to explain to the court.
While lockdowns and stay-at-home directives have been crucial in limiting the spread of COVID-19, the figures indicate they have impacted cases of gender-based violence. To reduce the prevalence of the issue, government must come up with relevant laws to address it.
Staying in the African continent, African health ministers and representatives from countries are calling for stronger global solidarity to ensure COVID-19 vaccine equity. The ministers during the annual gathering for the 71st session of the World Health Organization Regional Committee for Africa set the health agenda for the next 12 months. According to them, the COVID-19 pandemic has demonstrated the urgent need for the global solidarity, which is highlighted by the need for countries to seek effective protective measures both individually and collectively. To also reinforce global solidarity, the WHO Director General, Dr. Tedros Ghebreyesus, also urged African countries to support an international treaty or other legal instrument to improve international cooperation on pandemic preparedness and response that will be discussed in November at a special session of the World Health Assembly. Let's go over to the United Kingdom, where researchers say they are seeing some waning of protection against COVID-19 infections in double-jabbed people. The real-world study includes data on positive COVID PCR test results between May and July this year among more than 1 million people who had received 2 doses of Pfizer or the AstraZeneca vaccine. Protection after 2 shots of Pfizer decreased from 88% at 1 month to 74% at 5 to 6 months. For AstraZeneca, the fall was from 77% to 67% at 4 to 5 months. Well, joining us right now to talk some more about this is Dr. Etienne Ukorobi, GP Registrar, Worcester Royal Hospital, England. He joins us now virtually. Thank you for joining us.
Thank you very much.
All right. Let's start with what we're hearing. About 100 deaths a day on the average in the UK. And this is as I think the UK has vaccinated about even more than 75% of its population. What really is happening?
Well, it is true that in the last 24 hours, about 149 persons have been said to have died after contacting COVID-19, and the UK has vaccinated 77.4% of its population. But I would say, comparing these figures to same time in January, I would say these are still quite low figures. And although the hospital admissions are rising and infection rates are rising gradually, I would say that this also cannot be compared to what we had sometime last year or in January. So, yeah, I would say the vaccine is still working and it's not as bad as it seems.
And another explanation also is needed, because we're hearing statistics that shows that now, among those dying, we're seeing more of the younger population. And so one begins to wonder, is it the Delta variant the issue, or that less of the younger population is actually vaccinated?
I mean, it is true that the vaccination program is gradually being extended to the younger population, and not all of them have been entirely vaccinated. And we also know that the Delta variant is more infectious, as it were, and can cause more serious illnesses. But I would say we've not particularly seen a remarkable difference in terms of the number of young people dying as compared to the older people. I still think from the reports that we've got from the Office of National Statistics, it still shows that more deaths have been from people that are older, so talking about the vulnerable groups and the over 70s. So I would say, yes, we've had records of young people dying to COVID, but I would say the numbers are not alarming.
Tell us about the antibody test, which we hear are widely offered to the UK public for the first time, and how are people open to it?
Well, the UK government has recently rolled out sort of an antibody testing beginning of this week, and it is basically to check for immunity and antibody generation from people who have been infected with COVID. So everyone over the age of 18, when they are having their PCR test done, would be able to opt in to have their antibodies tested. So there are two tests basically, and it will be done at home. The first one, as soon as you've found out that you've tested positive, and the second test will then take place 28 days after. And what this tends to achieve, is that it helps us understand better how the antibody protection works. It also lets us know the response that is happening in the wider community or in the wider population. And finally, it will give an opportunity to able to pick out those persons who are not able to mount an antibody response to the COVID virus. And those sets of people can be given what is known as a targeted booster dose to help prevent them from further infections.
Finally, Dr. Korobi, tell us your thoughts about this new data, which seems to suggest that the protection provided by 2 doses of Pfizer, AstraZeneca starts to fade within 6 months.
I mean, it is true that researchers have shown that those who have had double jabs of either the Pfizer vaccine or the Oxford AstraZeneca vaccines starts to reduce after 6 months. So protection from the Pfizer vaccine, it was found out that it starts to fall by about 14% after about 5 months from receiving the second jab of the vaccine, and that of Oxford AstraZeneca falls by about 10%, after receiving the second dose of the vaccine for 3 months. So yes, research has shown that there is a gradual decline in terms of immunity that people have got, and research is still in its early phase. More data needs to be captured to be able to make a conclusion. But if we are to go by the data that we have got, this would mean that people who have received their vaccine much earlier, so talking about the older population and the vulnerable population, might need to be revaccinated or probably given some sort of booster dose. And we might see this continue either annually, as we see with the flu vaccine, or somewhat biannually in a situation where you have one dose at the start of the year and you have another booster dose, towards the end of the year to cover for the winter period.
And since research is still ongoing, it means that we will talk to you sometime in the nearest future. We'd like to thank you for joining us on the programme, Dr. Esen Okorobi, GP Registrar, Worcester Royal Hospital, England. Thanks for joining us.
Thank you very much.
And a U.S. intelligence report requested by President Biden into the origins of COVID-19 is inconclusive, U.S. media reports say. Agencies are reportedly divided on whether the virus first seen in China was the result of a natural spillover from animals to humans or was caused by a laboratory accident. Here's more on this and other developments on our COVID-19 update.
China has accused the U.S. of politicization in its efforts to trace the origin of the coronavirus, demanding a U.S. military lab be investigated. It comes ahead of the release of a U.S. report intended to resolve disputes among intelligence agencies, considering different theories about how the coronavirus emerged, including a once-dismissed theory about a Chinese lab accident. In other developments, the World Health Organization says coronavirus surges, driven in parts by the Delta variant, are pushing health systems of some Western Pacific countries dangerously close to a red line.
Until a few weeks ago, our region had fared comparatively well, with around 2% of global cases and deaths. But several countries in the Western Pacific are now experiencing surges, in part driven by the Delta variant. And our share of global cases and death is rising sharply.
Over 6 million people across the region have been infected with coronavirus, and over 82,000 have died, with Indonesia, the Philippines, and Malaysia having the highest number of cases. Meanwhile, New Zealand has reported 62 new COVID-19 cases, taking the total number of cases in the latest outbreak to 210.
Nobody wants to be in lockdown, and the best way that we can return to enjoying the freedoms that we have had for much of the last year is to get very high levels of vaccination. So we do need to shift from things like our border restrictions and lockdown measures being our main lines of defence to vaccination being a much bigger collective defence against the virus.
In neighbouring Australia, Sydney's COVID-19 cases has risen to a new daily record as officials urge an increase in vaccinations to help curb the rate of hospitalizations.
And we end on a sad note. News just in, a factional chairman of the People's Democratic Party, PDP, in Lagos State, Dr. Dominic Agbola, on Wednesday died of COVID-19 related ailments. Confirming the death of Dr. Agbola, the publicity secretary of the party, Mr. Taufik Ghani, stated that the late senior medical practitioner was an exceptional politician. He was the medical director of Santa Maria Hospital. Dr. Dominic was a grassroots politician from the days of Action Group. Don't forget to stay safe and indeed take a look at our website. It's channelstv.com for the latest updates. Thank you for watching. I'm Melissa Ntwaka. Stay safe.